Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is offered at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Shirley Soleiman. Dr. Soleiman is a board-certified physician and injectable specialist and the founder of the Cosmetic Injectable Center in Sherman Oaks, California. Today, we'll be discussing filler correction. So sometimes you may not like the result of your filler. So today we're going to talk about filler correction. So what exactly are injectable fillers?
Fillers are substances, because there's options. I say that plural because we have different options, that are placed under the skin to create either volume, fill a line, or potentially even change the facial structure for maybe a more feminine face or a more masculine face. So gender-affirming type procedures.
When exactly would you need this, or what would the signs be to know that you might need filler correction?
So if you feel like something's asymmetrical, or if you have lumps and bumps, or again, if you thought that big lips would look great on you, but then you have them done and you just like your old smaller lips better because it just fits your face better, it could just be a personal choice. Then you have that option to dissolve the filler. There are potential times where if the filler is inhibiting the travel of blood, which carries oxygen with it, to the anticipated area, such as a part of the cheek or somewhere else on the face, then it's good that we can actually undo that blockage so that blood flow will be regained. So there's some safety, I want to say seatbelt, that you can actually undo anything that you just don't like the results of.
And how exactly does it work? Is it another injectable just like the filler was?
Yes. Okay. So you just inject it into the area where you don't want the filler to remain.
And can filler be removed?
Through the injection of the hyaluronidase, you can actually dissolve that filler if it's hyaluronic acid based. So there are other filler types. FDA-approved filler types include PLLA, polylactic acid, and calcium hydroxyapatite. Those are not as reversible, as easily reversible as the hyaluronic acids. So it just depends what kind of product was used.
And how long can filler be manipulated for?
So after injection, it comes out of a needle, right? So it's liquid. It can be manipulated a lot for the first 3 days. But after that, it settles into place. You can still manipulate it if you really massage it firmly. You can break it down, but it's a little bit more gelatinized. So the longer you wait, the more stable it is.
And how long would the process take to reverse the filler?
So if we're using the hyaluronidase, which is an enzyme, as I mentioned before, that breaks it down, that can start working within 5 minutes, and it can work all the way up to 24 hours.
Is this process painful? Is there anything specific that patients should do to care for it after they do this?
So it burns a little bit, but if you mix a little bit of numbing with it, it makes it a lot more comfortable, and also depends where you're injecting it, right? It's not going to be as painful in the cheeks as it would be in the lips, for example. But I tend to mix a little bit of lidocaine in that, which is a numbing agent. So as you're injecting the hyaluronidase, you also get some numbing effect.
We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on filler correction. And if a patient wanted to opt for this, how much would they expect to pay?
Depends where you go and how much filler removal is utilized. I'd say at our office, somewhere between $50 to maybe $300.
Okay.
Depending again on how many visits and how much reversal agent is used.
And do you offer financing options if someone wanted to opt for that?
We sure do. We like our CareCredit. Our patients like it too. It helps to pay over time if you just can't have the ability to pay it all at once. Credit cards help. And of course, we try to work with our patients at our office in terms of making it more affordable. We also don't charge, if we've done the filler ourselves, we don't charge to reverse it.
Oh, that's amazing. Can you tell me a little bit more about your clinic? I know it's based in Sherman Oaks, California.
Yes, I got into this industry more because I had a procedure that went bad.
Okay.
My under eyes were done and it looked dark. I looked bruised for 6 months. Wow. And I didn't even know that was reversible. I just thought it was a bruise. So finding out that it's reversible and that I can actually have the under eye done without that kind of complication got me into just learning more and more about the industry and about cosmetic injectables. And I started offering it to patients and they loved it. And it just, the field chose me and I chose the field right back. And so I kind of hyper-focused on cosmetic injectables and grew that aspect. And I really enjoy being really good at one thing, right? So that's been our focus and it's been expanding since then. We're now in Sherman Oaks and we have 3 nurses working for us and an esthetician and a big team just to provide the customer service for our patients that they deserve.
Wow. And what other procedures do you offer at your clinic?
We offer M-Sculpt Neo, which helps reduce fat and gain muscle. We do threads, which helps to firm the skin. We have lasers for pigmentation and for bruising, to remove bruising, and also for redness. And we've got radiofrequency for tightening of the skin. We have facials and, PRP, PRF, microneedling. Fun stuff. So a lot of things that are cosmetic and injectables related.
If there's one thing that you love about your job, is there something specific that stands out to you about your clinic or your career so far?
I love meeting new people. I love meeting patients. In my clinical trial studies, I feel like I meet so many incredible people there. And AMIs, where I teach as a faculty, I've just gotten to know so many people through that. And I think it's given me a lot of opportunity to get to know you and all the staff here too. It's great to do what I do.
It's wonderful to share your knowledge with everyone.
I enjoy it, is what I can tell you.
Well, thank you so much for being here today and sharing your knowledge with me.
Thank you for having me.
Thank you for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.